Welcome to Tocilizumab Chronicles Beyond the Cytokine Storm. I'm your host, Dr. Shikha Agrawal, ready to dive in to explore the tocilizumab's target, that is IL-6. In today's episode on understanding IL-6 role in inflammation, immune response and disease pathogenesis, we are going to explore the fascinating world of IL-6, a cytokine that plays a crucial role in our immune system. Once again, joining me today is Prachi Virat, our dedicated microbiology enthusiast. Welcome to the show, Prachi.
It's a pleasure to be here, Dr. Shikha.
Let's start with the basics. Can you tell us what IL-6 is and its role in our immune system?
Absolutely. Interleukin 6 or IL-6 for short is a type of signaling molecule called a cytokine. Think of cytokines as an immune system's messenger. They help cell communicate, especially during infections or injuries. IL-6 play a key role in kickstarting inflammation when the body detects problem, like a virus or bacteria. It tells immune cells to spring into action, produce fever and other responses to help fight off the threat.
That leads really nicely into my next question. How does IL-6 contribute to inflammation?
Great question. IL-6 is a pro-inflammatory cytokine, meaning it promotes inflammation. When our body detects an infection or injury, IL-6 acts as a key signaling molecule that alerts the immune system. It triggers a cascade of immune responses, including fever, production of acute phase protein by liver, and activation of immune cells like T cells and B cells. In the right amount, it helps the body heal and defend itself.
Speaking of that, it does raise an interesting point though. What happens when IL-6 is overproduced or dysregulated?
I'm glad you asked that. It's something a lot of people wonder about. When IL-6 is overproduced or dysregulated, it can tip the balance from helpful to harmful. Instead of resolving inflammation, it can prolong or intensify it, leading to what's known as chronic inflammation. This is the major driver in disease like rheumatoid arthritis, certain cancers, and even severe COVID-19, where an uncontrolled immune response, sometimes called cytokine storm, causes damage to healthy tissues.
Wow, that's quite a list. Can you tell us about the role of IL-6 in disease pathogenesis?
Yes, certainly. Elevated level of IL-6 have been implicated in the pathogenesis of several diseases, autoimmune disorders, cardiovascular disease, cancer, and various inflammatory conditions. For example, in rheumatoid arthritis, IL-6 promote inflammation and joint destruction. In cardiovascular disease, IL-6 contribute to the development of atherosclerosis. In cancer, IL-6 can produce tumor growth and metastasis. And in COVID-19, high IL-6 level are associated with respiratory failure and worse outcome.
Those are some serious conditions. How does understanding IL-6 help us develop treatments for these diseases?
Understanding how IL-6 work and when it becomes problematic is central to developing targeted treatments. That's where IL-6 inhibitors like Tocilizumab come in. By blocking the IL-6 receptor, these drugs help dampen excessive inflammation without completely shutting down the immune system. This approach has proven effective in diseases like rheumatoid arthritis, juvenile idiopathic arthritis, and more recently in treating severe COVID-19 cases. So, IL-6 is both a vital player in our defense system and, when unchecked, a contributor to disease. And targeting it therapeutically has opened up important new avenues in medicine.
That's amazing. Before we wrap up, what do you think is the most important takeaway from our conversation about IL-6?
I think the most important takeaway is that IL-6 is a complex cytokine with both beneficial and detrimental effects. Understanding its role in our immune system and disease pathogenesis can help us develop more effective treatment for various diseases.
Prachi, I really appreciate you taking the time to break this down so clearly for our listeners. So that's all for today's episode. Thank you, listeners, for tuning into Tocilizumab Chronicles Beyond the Cytokine Storm. Don't forget to subscribe and share this episode if you found it valuable. Till then, stay curious.